we're so appreciative of everyone being here with us tonight.
All right, hopefully everyone has settled in, wound down from their busy day. Good evening and welcome. My name is Kevin Collins. I use he, him pronouns, and I serve as the Director of Training and Outreach here at Health Equity Solutions. We're so pleased to celebrate Connecticut's 4th annual Health Equity Week with you all today. Before we get started, some quick housekeeping items. Please continue to share your thoughts in the chat as we go throughout the workshop, the presentation, and the Q&A. We want to make sure that we're hearing from all of you. In addition to the chat box, you can also join the conversation on Facebook and Twitter using hashtag #PathToEquity or hashtag HEW22. And we have a continuously open survey on our blog page where you can share detailed feedback on the path to equity. We're so excited to have you join us here tonight for an interactive workshop on what advocacy is, how it can be used as a tool for change, who is an advocate, and when to advocate. We will be hearing from a key expert this evening on how you can use your story in a way that persuades policymakers to make decisions that support health equity and equity in general in Connecticut. I want to take a moment to express our appreciation of our advocate sponsor, Stanley Black & Decker, and our supporter sponsors, and to acknowledge the HES staff who plan not only this event tonight, but a week's worth of opportunities to get involved in health equity. You can follow along the week's activities with the link in the chat, and I hope you enjoy and thank you for being here and being an ally in advancing health equity. I also want to make a note that if you would like translation services, just click the globe icon in the bottom right of your Zoom screen and click either Spanish or English. With that, I'm going to pass it over to my colleague, Taylor Tucker.
Thank you so much, Kevin. Good evening, everyone. And thank you for joining us. My name is Taylor Tucker. I use he, him pronouns. I'm the program manager of training and outreach here at Health Equity Solutions. And before we get started tonight, I'd really like to introduce you to HES. Health Equity Solutions is a nonprofit located in Hartford, Connecticut, whose mission is to promote policies, programs, and practices that result in equitable healthcare access and health outcomes for all people of Connecticut. We have 3 distinct arms of our organization: policy and advocacy, training and outreach, and community engagement. Although designated in different areas, we all overlap and work together to support each other and help us attain HES's mission and vision.
Thanks, Taylor. This is our beautiful, amazing staff. HES's staff has grown remarkably in the last 7 years. I'm thrilled to introduce you to some of those staff members, our board of directors, and as well, our interim president, Alicia Santilli, along with our other board of directors. We've grown from a staff of 1 to a staff of 11 employees and 1 intern. Thank you, Sean. Shout out to Sean. You can see staff photos and read our bios with the link posted in the chat. Now, without further ado, I'll pass it back to Taylor.
Hi, everyone. And so, defining advocacy, there may feel as though there's been a recent increase in the frequency of the word advocacy. I know it appears all over social media, professional development seminars, and even in the daily news. And the most common comments or questions that we are often asked are, what exactly is advocacy? What does it mean? And how do I do advocacy? Advocacy is defined as the process of supporting a cause, proposal, or policy. Advocacy is an action word. It's something that the act or process of advocating for and making your voice heard individually or collectively on an issue that is important to you.
Thanks, Taylor. We also want to make sure we discuss the 5 W's of advocacy. So advocacy can take on many different forms, but it's important that you outline and answer these 5 questions. Who, what, when, where, why, and how. Who are you advocating alongside? Why are you advocating? For which issue are you advocating for? Who will this advocacy impact the most? Who's closest to the issue of which you're advocating? These are all extremely important questions that you need to have a sound answer as you're entering whatever advocacy effort you are.
We are going to start with the what, which is naming the issue. As we begin to discuss various steps, and as Kevin mentioned, the various aspects and W's and the 1H of advocacy, when we talk about successfully advocating, the very first step is to clearly define your issue. Defining your issue allows for a broader understanding and transparent path as we advocate. And the clearer your issue it is, the easier it is to educate others, to spread awareness and messaging, and to build a cohesive goal that's understood by everyone, including and especially policymakers. We want to also remind everyone that you can advocate for any need, regardless if they're individual or smaller scale, or community and nationally based on a large scale. But it's important to always start with a clearly defined issue, which can help you build the structure and strength of your advocacy power. And here we're also going to name the who of the advocacy efforts. I like to imagine this process as structuring and defining your who, starting out small and taking step backs and zooming out as you go. When we start this process, it's helpful to look at the immediate issue in which individuals are most impacted. Then, as you build your structure and your goals for advocacy, take a small step back, look who else is affected. It might be a block in your neighborhood or a group of parents at a specific elementary school. And then you can take one more step back, and depending on how large your issue is, you can start to see who else is affected, how to build power, and who else can support the issue. Does your whole town need more green space funding? Does your state need better roadway care? Is healthcare not accessible in this country? By taking smaller steps out and building your who, it allows you to see how many people are affected, and it helps us to build power as you start to act with your advocacy efforts. I'll share a quick example tonight. So someone, for example, who utilizes the bus transportation system here in Connecticut notices outside that it's terrible weather and their bus stop doesn't have adequate shelter. So due to the possible prolonged waiting outside in harsh weather, this individual develops health problems, or their already underlying health problems are exacerbated. The possible making them miss work due to illness or needing more healthcare appointments, which they're also still waiting outside for in a non-sheltered bus station, and then missing out on needed income. And we can see how this situation can snowball on the individual level. And so then we take a step back at the neighborhood level, and we see that this lack of shelter at bus stops, can correlate to specific neighborhoods who have high population of bus use, which forces a high number of people to be exposed to unsafe outdoor elements for possible extended periods of time. Now this problem has been felt across the neighborhood, both individually and with the majority of people here, creating neighborhood-wide health inequity because the transportation system was not and is not built to be safe, accessible, or equitable for everyone. So now this individual in their neighborhood decided to change the lack of safe bus stops. So they created a coalition and asked for cities across the state to share their stories and get involved so that they can make state level policy change that would mandate appropriate needs for shelter. And so that's just a really broad designed example to share how an individual impact can also become a statewide impact and neighborhood impact, and how defining your who, you can build power. And later tonight, we're really excited. So we're gonna be talking more in depth with our guest about how we define the who and how do we build coalition power.
Thanks for that example, Taylor. As I stated earlier, there are many ways to advocate. You get to decide what you are most comfortable with and what makes the most sense for the issue of which you're advocating. Methods include hosting a local issue forum that brings folks together to amplify an issue and garner support. You can also participate in a public forum, such as a legislative hearing, to testify orally or submit written testimony, or you can attend local town halls. You can also utilize various forms of media, writing letters to an editor, op-eds, using social media to raise concerns and amplify issues, or you can hold one-on-one conversations with your legislator. As stated before, determining the issue is also important to the how. Who is most impacted by the issue? If you're advocating as an ally, make sure you are in step with the groups who are directly impacted by the issue. Remember that goal setting timelines and benchmarks to make sure you're not flying by the seat of your pants. Also making sure the coalition build. There is strength in numbers. Collaborate, collaborate, collaborate. And also make sure you're utilizing storytelling as a tool. It's a powerful one. Numbers are helpful, fact sheets are helpful, but it's hard to manipulate the story that you hear. They can be extremely impactful.
So now we get to location. And let us remind you that Kevin and I spoke through tonight that advocacy can happen anywhere. We know there are advocates who work on a national level, pushing for federal change in DC. There are individuals and organizations working to advance statewide policy, like ourselves, our partners, and our community members here in Hartford at the state capitol. And we know there are town residents who are working endlessly to make change in their local town level through town councils and boards of education. And while advocacy has maybe traditionally been thought of operating on large scale levels or formal spaces, those areas are critical, but it's not the only place that advocacy can be impactful. You know, advocacy is an action word, as we have stated, and it involves speaking up and taking steps to address issues that are important to you. And that can happen exactly where you are right now. It can happen with families and friends, coworkers, and your immediate community. Building collective power and action plans can often start with those directly involved with daily. And also, as Kevin mentioned, advocating in our close community is an essential way for allies to be involved. And so by following already established community leaders, working to support and make change directly where they exist, allies can play an impactful role without taking up leadership space or speaking space on issues that don't exactly directly affect them. And so all forms of advocacy are meaningful.
Absolutely. So when is the right time to advocate? It's important to make sure you're aware of local, state, and federal level policymaking timelines and how they'll impact your advocacy work. Cities and town councils likely meet year-round, while state legislators typically have a legislative window, otherwise known as legislative sessions. It's also important to remember that even with specific timetables, you always have access to reps, local leaders, and other policymakers, not only during legislative sessions. You can reach out to them via social media, email, one-on-one meetings, and other forms of correspondence. And then we come to our last W. It's last, but certainly not least. You have to know your why. There can be multiple whys for your advocacy efforts. It can be deeply personal and at the same time come from a place of collective community power. This list before you is not an exhaustive list, but just touches on the surface of some of the whys of advocacy. As shared, elected officials and policymakers are put into office by voters, and advocacy is a way to hold them accountable. Policymakers are not always experts in everything that they make decisions on. They rely on us, community members, to show up and advocate. Community members are the experts of their experience and how policies directly impact our lives. We elect policymakers to make informed decisions, and we can use advocacy to continue to aid and educate them. Advocacy provides a direct line of communication from the community and the people who often face the most barriers and who are directly impacted by policymaker decisions to those policymakers. Too often, we see policies are debated and created in spaces that don't center the human experience. Not understanding in those moments how those policies directly impact the people in their lives. This is why individual and community advocacy in all forms, including storytelling, is such a powerful tool.
Amazing. Thank you, Kevin. And I love that reminder to sit with our why for this work. So it's important also for us to name and recognize that even with all of these steps and practices, best models, all of the support, it can still be really hard and exhausting. And so while there may not be a perfect formula for sustaining advocacy, here are some of the ways in which you can support yourself and build community support during your advocacy work. And so we talk about tapping into everyone's specific strengths in a strength-based approach. And so everyone has a role to play. Some of the best advocates I know and leaders talk about the ways in which individual strengths are such strong assets. So are you really good with emails and organizing? Do you have a great skill at writing? Can you do a TikTok viral dance? Are you an excellent cook or baker? Do you have a car with a lot of space that can transport people and support the needs of different drives? And do you have free time and you love talking on the phone? So everyone has a role to play in advocacy. And when you utilize everyone's strengths, the work is powerful. And working within your community strengths helps with the prioritizing of individual actions. We can't do everything alone. And so being able to play to our community strengths allows us to prioritize our own rest too. And rest is critical so that you, your community, our community can continue to advocate and push for change. When we rely on community, it's essential. Whether you're advocating for yourself on a smaller personal issue, or there's a statewide policy, having your community to support you, uplift you, and help you recharge is critical.
Absolutely. So here are just a few examples of HES's advocacy efforts. You all may or may not know about Senate Bill 1, the act that declared racism a public health crisis in the state and also created the Commission on Racial Equity and Public Health. We're also working hard on community benefit and affordability, as well as our path to equity. And up next, as we promised, we have a member of the community who has done such impactful, powerful, amazing work across the state. We're so grateful to our panelists tonight for your time and for all you do. I am so thrilled and honored to introduce to you all Reverend Robyn Anderson from the Ministerial Health Fellowship. Reverend Anderson, would you please introduce yourself and tell us what's your why in your work?
Okay, thank you. Good evening, everyone. I am honored, humbled and honored to be here on today. One of the things that I think that's so important with the advocacy work that we continue to do and why. I am Native American and also African American, and I'm also legally blind. And so some years ago, I was driving home one day and everything went dim. And then it came back and it was really like a grayish color, hazel color. I did not know what was happening. I was very frightened. And so to make a long story short, I went to the doctor, to the eye doctor. And when I went to the eye doctor, they told me it was a problem probably in the back of my eye. And so they were going to send me to a specialist. And so when I got to the specialist said to me, "Do you know that you don't have any insurance?" I said, "What do you mean I don't have any insurance?" He says, "Well, the card you gave me for your insurance has expired." Well, the nonprofit organization that I was working for had some difficulties financially, and they were receiving delayed payments from the state funded grants that they were receiving. So they had not paid the premium. And so what the doctor also said to me, there's a big problem. There's some hemorrhaging in the back of your eyes. And so I'm going to send you to someone else who probably can, maybe they can help you or help you to see what you need, but you're going to need some extensive care. And so I never will forget that. I went to another specialist that they had sent me to. And when I got there, he said, your eyes are hemorrhaging. He says, you're going to have to go to the hospital. You know, the disease that you have, in my 35 years of practicing, I've only seen 10 cases, and it's found in African Americans and those that have Indian ancestry. And right now, there's only 400 cases in the country. And so I have both. So anyway, to make a long story short, I ended up having to go to, he got me into a protocol at the National Institute of Health, because he said, because of your insurance, no, lack of insurance, nobody's going to treat this, and because it's going to require a lot. So anyway, make a long story short, I ended up in the hospital for over 3 weeks, and then just back and forth until they could kind of get the hemorrhaging under control. But thanks be to God that I was able to get into a protocol. And so that is my why, because I felt at that moment, in the most vulnerable state that I was in, that I was actually going blind, and the prognosis was that I would be blind. And he said, and if it had been even another week or so, that would exactly have happened, and they could not get me into that protocol. And so my advocacy work is fueled by the fact that no one should not have health insurance. No one should not have affordable health care. No one should not be able to not go and take care of a medical issue that they have. And I've had many members of my congregation in church also, who also did not have health care and had to have emergency surgery at that moment, and was scared to go to the doctor. I had one that actually had a stroke also. And so, you know, my advocacy work is around really making sure that I am able to raise my voice and be a voice for those that may not be able to raise their voice, not just growing up being African American and Native American, and seeing so many of my family members who have gone blind, who have been amputees, double amputees, because of the lack of health insurance and because of affordable health insurance, and not really being able to take care of themselves physically because of not being able to afford health care. I think that health care should be for all people. And so because of that, I continue to advocate to address health disparities, to have policy changes that will continue to address the health care of people of color. And I will not stop until that happens. Thank you.
And thank you so eternally much for sharing that with us. So incredibly grateful. And I hear, you know, the power behind that story. And I want to ask you a little bit about the importance of storytelling for you and how it plays a key role for you in policymaking.
I think storytelling is so key and so important. It's because your story has a lot of impact, and it becomes real to someone else as they listen to that particular your story. And so even a part of the work that we do, and I should have said I'm the executive director for the Ministerial Health Fellowship. I'm also the pastor for the Blackwell AME Zion Church, which is also located in Hartford. And so many of the work that we do, even as the Ministerial Health Fellowship, not only are we coming together as advocates, but also we're out in the community. We have crisis counselors, we have case managers, we have recovery coaches, we have doulas who are out there in the community, who are hearing stories, who have real stories about what happened, and really and part of their work is also not only to tell their story, they have their own stories, but to encourage others to tell their stories also, so that changes can happen, so that policy changes can happen that will help to address the health concerns of people of color and people that they come in contact with. So I strongly believe that storytelling is important, and it's something about that's so empowering and invigorating when people are able to tell their story and someone is listening. So not only does it work in terms of people being able to hear the story and it becomes real to them and they can connect to them, but the person that's telling the story is also empowered that to be able to tell their story and to know that someone else is listening and that it's going to make a difference, not just for themselves, but for others.
Oh, thank you, Reverend Anderson. We know you wear so many hats. You do so much in the community. We'd love to get some thoughts from you around coalition building. What do you believe are some best practices and or methods someone should consider as it relates to coalition building strategies?
Well, I really believe that we're all in this together. And so I just believe that we're more powerful when we're together than to be in our silos. And so really, to me, the capacity building is also around, again, we started out the Ministerial Health Fellowship with pastors. And so, and working with pastors, we spent about 2 years just learning everything about legislation, the advocacy work, and all of that. And so once they got it, we say, yes, we need to get our churches involved because first of all, we're shepherds. And so we're very protective of our people. And we want to make sure, what we're getting ourselves into, that we're knowledgeable about it. And then we also invited other church leaders and then the congregation and then community members, community organizations. And we continue to build that with other advocacy groups. And we partner together, just like Health Equity Solutions is a great part of our capacity building. And we have consulted with them and worked with them. And then also all of our staff are not only advocates themselves, trained to be advocates, but they also have the ability to also train the people that they're working with to also become advocates as well.
Absolutely. We are so grateful to be a partner with you and to be in this work together. And so I was wondering if you could share with us some of the ways that people could engage with your work and your specific advocacy efforts.
Well, whosoever will, let them come. Our doors are open, our arms are open. Come on and be a part of the work that we are continuing to do. We were also very much a part of declaring racism as a public health issues in our other towns that we were in, joining Health Equity, also in the race, ethnic, and language data, also in the community health workers bill as well. And then recently we also didn't get out of committee, but we're still working on it. And that was to raise, we're part of raising the Husky income level, but also we also asked Senator Lesser to sponsor the bill of raising cover Connecticut income level to 300. And so we, continue to, do that work and work together. So anyone who is a part of that, and also Husky for Immigrants, we're also part of that. We are just doing whatever we can to make sure that people of color have access to healthcare, have access to dental care as well. That's also important. Oral health is so important. So we're all part of that. Anything that will continue to help people of color to remain healthy, to be healthy. And also because you can have programs, but if you don't have policy changes that happen, usually that you have to have policy changes that's in order to be able to address the disparity. And if we have not learned anything yet from COVID-19, we already knew the health disparities existed, but the covers have been really pulled off. And we can see it. And if we don't do anything about this now, and we don't continue to raise our voices for equity like never before, we haven't even gotten to post-pandemic to see what that's like. But I do believe that we have to come together, we have to work together, and we have to raise our voices, roll up our sleeves, churches, lay people, community people, our legislators, everybody working together to make sure that we stay healthy, that we have programs that will keep us healthy, that we have insurance, that we're able to do whatever we need to do to take care of ourselves. And I just believe the quote that I always say that Calvin rolled out, the only ones that can save us is us. We have to lift our voices.
Absolutely. Reverend Anderson, I'm going to have to send my tithe and offering to you and your church. You're giving us a word tonight. One question that is not one question I have is not on our script, but I'm wondering, for the folks who maybe haven't gotten involved in any advocacy efforts yet, what are some first baby steps one can take to just skim the surface of getting involved in advocacy?
Well, I think one of the things in getting involved in advocacy, think about even your own story, because I do believe everyone has a story. And so think about even something that you felt at some point that you were not getting what you need in order for you to not only just stay healthy, but even in your mind and in your body and in your spirit, or you felt like something was just not right, or something that you were not treated right, or you saw somebody else mistreated. And so what could you do? How could you make a difference in that person's life? What would you want to get involved in that will help you? How were you able to help them? If they could not lift their voices, how would you speak for them? How would you encourage them to lift their voices up as well? But I just do believe that, again, advocacy work is so important. And I just believe that all of us, whether we know it or not, we're advocates ourselves. And if you're a parent, you have a child, you have to be able to advocate for your child, whether it's in school, whether, making sure that the child gets the right care that they need. Your parents, when they get older, you end up being the person that speaks up for them. So think about it in that way. What is it? What passion, what's in your heart that you would really like to see change? And what will it take to make that change? How can you be that change? How can you be that change agent that will be able to champion that change to happen? And so, again, I invite you to come and be a part anytime of the Ministerial Health Fellowship. We meet the second Monday of each month at 6 o'clock, and everyone is welcome. Everyone is invited, and we just work together to continue to champion health equity. We're really got in this mode of what we call radical healing that needs to take place in our community. And also the fact that we have to be the ones that mobilize. We have to continue to galvanize and get people together that we might continue to lift our voices and make the difference that needs to, not just today, but for even the generations to come.
I have chills hearing you talk about the power of story and the power that all of us hold, and also what that looks like collectively. And how this works. And so I'm just so grateful. And you talked a lot about kind of obviously some things more in depth that Kevin and I just gave a brief overview tonight. And one of the things, as you've done this work for so long, as you've worn so many hats, as you've supported so many things, like you've said, what does it look like for you, and what are methods for you to avoid burnout, especially when the work is long lasting and is a long-term goal? What are those kind of methods that support you to avoid burnout?
Well, I think I realized that no, I can't do this by myself. I definitely cannot do this by myself. So I need others. And I'm telling you, I would say that we have a great coalition, great also staff that are with the Ministerial Health Fellowship who work hard, who are out there paving the pavement every day in the community and working with people, and not only finding resources for them, but also showing them how to also advocate for themselves, how to speak up for themselves. And so they're also, not only are they empowered, but they're also being able to, empower other people as well. And so for me, that also lets me know that sometimes also, the work does get hard, and the work does, you do get weary. And so, you have to take care of yourself. And so one of the things that I am, always my self-care is making sure that, one, I get, the rest that I need, but every now and then I just got to steal away, and make sure, first of all, that I'm making sure that I'm focused and that I take it very seriously. I can't leave people where I can't go either, or I'm too tired to go. And so really spending that time, with God and getting my direction from God in terms of the direction in which God would have me to. And every now and then just shutting off and shutting down everything until I can get recharged and renewed, also that I might continue to go forward. But I think it's also important in this work, you have to have people that you can depend on. You have to have people that are like-minded, also that are really serious about this advocacy work. And it can't be competitive. We can't compete with each other. It's not about competing. We're advocating for people's lives and people's lives to be changed, for people to live, also, and to be healthy. So we can't be competitive. But even how can, and that also will help also to avoid burnout if we all kind of continue to work together and we support each other. In other words, we work smarter, but we work together. And so again, eating healthy is also another thing that I also do, making sure that I do eat healthy also, and, really enjoying myself with family members, enjoying myself with friends. I have lots of friends. I have a really great support system, also. But again, the main thing is that I stay as close as I can to God, because I realize I can't do nothing without God.
Absolutely. Thank you so much. So we're moving to the end of the conversation piece. But before we end, can you share 1 or 3 hopes you want everyone to take away from tonight's conversation, to take away from methods to advocate, to take away from anything you've said tonight?
I think one of the things, if I would like to leave with everyone, is to, one, also know that not only do you have a voice, but you also have the capability to be a voice for others and to encourage others to be a voice as well. And then the second thing that I want to also say, that as we talk about health equity, we can't talk about racism. And so we have to also be champions of addressing systemic and structural racism, and that we have to not be afraid to talk about it, to put it out there. Health disparities are, I don't care how you look at it, it's attached to racism. Inadequate health care and affordable health care and affordable dental care is attached to racism. Policy changes that do not allow people of color to have the access that they need to be able to have affordable health care is attached to racism. And so we have to also really, and then even husky for immigrants and not immigrants that are here, they're here, they're working, they're continuing. And so they need to also have health care as well. And they should have health care since they are here and they're part of our country, part of our state, part of our community also. And so, and then the other thing that I want to say, don't do it by yourself. Let's come together. Let's work together. We are stronger together. And so it doesn't take away from any of us, but it actually it fuels us, and it continues to make our advocacy work even stronger. And so I believe that if we continue to build that capacity and we continue to come together, I believe we'll continue to be a force to be reckoned with, and many policies changes will happen. And that as our young people come and they see, wow, not only are they doing it, but I want to be involved in that. I want to make sure I'm a part of this change that is continuing to happen, that's going to make our communities, make our households, make our state, and make our nation better.
There's just so much that you've shared that I know, and I don't often want to speak for everyone, but I'm hoping I can speak for everyone that will just continue to digest with, continue to learn from this conversation. And I want to extend our most eternal gratitude and thank you to our amazing panelists tonight, Reverend Robert Anderson, and for all the work that you do, and for generously spending a Wednesday evening with us and sharing your story, sharing your advocacy, sharing your skills and your knowledge with us. We are so blessed to have you here. And we also wanted to open it up for a space For anyone that might have questions, I know we posted it in the chat if there's any questions, but this is really kind of more of an open space. If you have any questions, please feel free to drop them in the chat or use the raise hand function. So we have a little bit of time if anyone even wants to say thank you, wants to open it up. This is a perfect time for it.
And I just want to say also, thank you. Thank each and every one of you, and thank Health Equity Solutions. I tell you, they have done some great, marvelous, and continue to do some great and marvelous work. And I am just so blessed also by your leadership, Dr. Takesha Everett and Aisha Clark and all Karen Siegel, and I'll start getting in trouble by naming all of the staff at HES that has continued also to work with us. And also we've learned so much from you. And we thank you so much.
Thank you. Any questions? Again, feel free to drop them in the chat or raise your hand. Angela, hello. Go ahead.
Good evening, Reverend Anderson. I would like to, thank you for all you do for the community, not just in Middletown, but across the state. We here in Hartford appreciate you so much. Wanted to know, in all your coalition building, you have the Ministerial Health Fellowship, you've got the Greater Middletown Health Enhancement Community, and the work you do with the various conferences in your denomination and so on. What do you think over the last few years has been your greatest challenge in doing that coalition building?
I think what has been the greatest challenge, well, several of them, but probably the greatest challenge is also, in the midst of the pandemic. And, my biggest concern was making sure that especially our people of color had the information that they need and had the correct facts. And so a big part of that is that's why we developed the faith-based clinic also at the Cross Street Church in Middletown. And that was also because many people were saying to me they weren't seeing our people coming to places, getting vaccinated. And so I felt like it was just so crucial and so important that we get that information out, that we get it into their hands, and not just through, it's nice to have PSAs and it's nice to, have conversations and town hall meetings, but really felt like we needed to go door to door and to do that. And so one of the challenges, well, who we're going to get to do all of that and how we're going to get it. And so it was truly a blessing to be able to partner with FEMA, and also to be able to get community health workers and COVID-19 crisis counselors on the ground, knocking on doors, coming together. We put together wellness kits, making sure many people didn't have thermometers, many people didn't have supplies, and making sure that people really had supplies. And I think the other challenge that really bothered me, that let me also know about why we continue to do this work and fueling it, was when they could not, so many people that were dying, especially here in the state of Connecticut, and they didn't have a mechanism of telling us how many. We knew it was people of color were dying in a disproportionate rate, but we didn't even have a mechanism to be able to count people. And so, wow, it was like, we're not even counted, and so that really was a challenge, and that really disturbed me, and to really, get that kind of advocacy work. But I think there's so many things that I think we should do, I would love to do. One, just really having the staffing, also having the support, financially to be able to do some of these things. We continue to function as a grassroots organization, but we are doing some great work. So I think that's also the challenge. There's so much, the work is so vast, and we continue to need laborers to be able to be a part of it. The Bible says that the harvest is plentiful, but the laborers are few. And so we need to continue to build those laborers.
Yeah, I'm gonna call you when I see your hand is raised.
So, hi, Reverend Robyn, it's Sylvia. I have a question. In your college years, if you could go back to the younger you and speak to the youth of our new generation about the importance of advocacy, what would you say to yourself about what you know now, and what can you speak to with the younger generation, maybe at the age of 25 or more, how impactful their voice can be?
Well, I would say that I've been an advocate for a long time. I remember even, because I grew up in Hartford and being at Hartford High. And so the big thing was at Hartford High, I was president of my senior class. And so at that time, the faculty, mainly the vice presidents, they told you everything you needed to do. And even at your senior ball, they actually wrote out your speech. And so what I did was that I was kind enough, nice enough, let her write the speech. We wrote the speech together, but when I got up to speak, I had my own speech, what I felt needed to be done. And so from that, she said to me, well, I see that you rewrote your speech, Robyn. And I said, well, yes, I did, because I felt like there were some things that needed to change, and I hope that the changes would be made for the next class to come. So don't ever think that your voice cannot be heard. Don't ever think that you're not in need of advocacy and that you can make a difference. I grew up in a family also during that time when I was growing up. Our tribe was not federally recognized. And so my grandfather was also a great advocate and also was part of the Indian Council and also responsible for the state recognition of our Indian tribe, as well as the materials that were put together for the federal recognition. So again, trust me, you're never too old to advocate, never too old to get involved with advocacy. And as it was so eloquently said today, advocacy is that when you see something that needs to be changed, when you see something that doesn't seem quite right and is not fair, that's marginalizing other people, you can be that change agent. You can be that person, no matter how old you are, no matter how young you are.
Absolutely. Thank you for that. Yeah, I see in the chat. Yes, that was a great question. Thank you for those questions. I had one come up only because I don't want to let you go yet, Reverend Anderson. For the folks who maybe feel like it's just them, it's only them who's identified this issue and it's just them fighting for it at the moment. How do you find allies, and how do you go about finding collaborators in coalition building? What are those first initial steps it takes to kind of start to identify folks you want to bring along with you?
I think, a couple of things that come to mind for me. And that would be, if I have something that I have an idea or something that I'm actually concerned about, then I start to really express it. And I may express it to people that I know or people that seem to be, concerned about, that particular issue that I'm, really concerned about. So in other words, if I felt like, for instance, that our street, because of the sewage that's in back of us, that is causing all of us to, I see people on my street that are developing asthma, people on my street that are really, sick all the time. And so I start to ask my neighbors, are you feeling sick? Do you smell that? Do you think we should do something about it? What do you think about it? How would you do something about it? What do you think we need to do? Should we work together? Would you like to work together? And maybe let's see if we can talk to the neighbor across the street. And then maybe we can talk to the neighbor down the street about it. So that's how you begin to really develop, to me, allies. But you got to be able to open your mouth and begin to talk about it. And if it's something that's concerning you, you better believe, I can guarantee you, it's concerning someone else as well. And they're concerned about it also, and probably looking for you to open up that door that they can join you and you can join together and get others to join together to address that issue.
Thank you. And so I see a question in the chat that talks about in advocacy, how do you measure success? And is there an importance in celebrating the wins?
I think about measuring success also in various ways. It depends on what you're doing. So in other words, for instance, as I mentioned even earlier, how, really talked to Senator Lesser, asked him to sponsor this bill to raise the income level of Cover Connecticut to 300. So in my mind, it's like, okay, I'm going to ask this question. I'm not sure how far to go, during this season, but I'm going to ask this question. So even if it doesn't work out now, it could work out, in the future, also, or either the next legislative session, but I'm not going to give up until this actually happens. And also sometimes people, we also live in a time, sometimes we're looking for everything to happen instantly, but sometimes things don't happen instantly. Sometimes you have to really stay your course and you have to really advocate for things. And believe it or not, you can see small changes that begin to happen. So the small change from as far as I'm concerned is that he heard me, he sponsored it, and so, again, so now we're on this role of continuing to work and see how we can raise that income level and work on that. Just like Husky, we talked about Husky for immigrants. It was children, 8 years old, and then we were able to continue. We weren't going to stop until it continues. So, a part of it is that, just everything, every time you move the needle a little bit more, that's success. Sometimes people don't feel successful because they're looking for things to happen instantaneously and right away. And sometimes things don't happen that way. And also not to give up, no matter what. If you feel strongly about something and you feel strongly that this should happen, it may not happen for 10 years, but you stick with it and it will happen. So I think, the measurement is that, continuing to measure. If you can get before people, you got people listening, so you have to really, and I think that that's what keeps people encouraged and going. If you're able to kind of look at, okay, what was our success this month? What was our success this year? This legislative session, what did we get? Where is these particular bills? How do we move it along? What are we going to do with that bill next time? How can we move it even further?
Awesome. Sylvia, is that a new hand or the same hand from before?
I'm sorry, I didn't lower my hand. I apologize.
No worries. No worries at all. Any other questions? Holly.
Thank you. First of all, Reverend Anderson, you are an amazing human being and you do so much good for so many that I couldn't go without saying thank you. And I had put it in the chat, but I think we still need to make sure that everyone in every community needs to be told that, hey, if you go to a doctor or, this system makes you feel like you're less than, or God forbid someone tells you you're less than because of this reason or that reason, chances are they've done it before. So you're definitely not alone. And there are so many people here on this call that you can reach out to. And this is why Reverend Anderson is such a good coalition builder. But, I think that that's really what we need to do is get back out into the communities once we can. I can't right now, still immunocompromised, and let people know you're never alone. There's always someone else out there who feels exactly the same way that you do. Just reach out. Look for the help and you will find it. But that's all I wanted to say, and say thank you so much for all that you do. Thank you.
And thank you, Holly, for all that you do as well. I mean, and our partnership also with you and with Keep the Promise, has continued to build. And I think that also, even as it relates to leveraging each other also, as you mentioned about being out in the community, we have people that are out in the community every day. So if you have things, that you would like to get to the community also, let us know, and we'll be willing to make sure it gets to the community. We knock on doors every day and speak to people and all throughout the state in various communities. Our staff, every Friday, they have an outreach project that they go to different parts of the state to do outreach.
Amazing.
Thank you.
I'm also loving seeing the outpouring and the pouring of love into you, Reverend Anderson. So often we do this work, and it's as if nobody sees it. We don't get a thank you. We don't get you're doing a great job, but I'm loving hearing folks say first, thank you to Robyn Anderson and how much they appreciate the work that you've done. I love it. I love it.
Well, thank you. And I say to God be the glory, because it is a calling, and my thing is that it's not for me, it's for the community, it's for others.
Awesome. Thank you.
Thank you.
Powerful moment, right? What a powerful phrase, Reverend Anderson, to say that it is for the community, it is for others, which is why we are tied to this work. And part of, I'm assuming a lot of our whys is for our communities. And so I just want to open up and make sure there's any last questions, any last comments as we begin to kind of wrap up our night. I know I'm feeling like I'm not ready to wrap up. And also, we understand that this is a program and it is 7 p.m. on a Wednesday night on Zoom. And so we want to be super mindful of everyone's time, Reverend Anderson's time. And so I'm just going to ask Sean very quickly to throw back up ways in which that you can specifically engage with HES. And so we really encourage everyone, if you would like to sign up for our newsletter and our action alerts. And so over the summer, we host listening sessions in our community that help us inform our policy agenda for the following legislative cycle. And this is where we get to hear from our community members. We get to be in support with our community about really what's most important and what builds our policy agenda and how we can achieve that. And so our newsletter is one of the key ways to be alerted about different sessions and different ways in which where we're holding listening sessions in the community. We're also on various social media platforms, Facebook, Twitter, Instagram, LinkedIn, and our communications team here at HES is incredible and does absolutely outstanding, amazing work all the time. They not only make alerts and give out newsletters and keep everyone updated, but they make incredible infographics that are super easily understood, beautiful to look at, easily shared, and that keep everybody informed on what's going on. And we also just want to thank everyone tonight so much for the engagement, for the love, for spending a Wednesday evening with us. We're so appreciative of everyone's time here, Reverend Anderson. Thank you again endlessly. And Kevin and I will drop our emails in the chat, and Reverend Anderson, we would love if you would as well. So if there's anything that you need, anytime you want to chat, please feel free to reach out to us at any time. We are always available. And we want to say thank you so much for everyone being here tonight and engaging.
And if I could say also, thank you so much. And also I wanted to mention one of the, the phenomenal work that Health Equity Solutions does. And even this time with Dawn Fuller, who has been working with us on developing the coalition, Health Equity for the People, by the People. And we're certainly also continuing to build capacity with that as well. And so again, we're all in this together. Let's work together.
Thank you all so much. Thank you, Reverend Anderson. Y'all have a good night.